This is a training video for the Sysmex XN550. In this video, I will be discussing startup, daily QC, running patient samples, daily shutdown, and routine cleaning. At the completion of this training video, laboratory employees will be able to perform daily maintenance and QC on the Sysmex XN550 analyzer under minimal supervision 100% of the time. At the completion of this training video, laboratory employees will also be able to accurately run patient samples on the Sysmex XN550 analyzer without supervision 100% of the time. Here we have a picture of the Sysmex XN550. This analyzer is capable of running CBCs, H&Hs, and body fluids. The monitor on top of the analyzer is touchscreen and is the control center for the machine. Throughout this training video, I will show you multiple examples of how to utilize the monitor. To the right of the analyzer is the Beyond Care Quality Monitor, commonly referred to as BCQM. The analyzer communicates with BCQM, which then in turn communicates with Sysmex technical support and alerts them of any issues with the analyzer. This is a website that can be accessed through any computer, but will always be open on the laptop, so it can be quickly seen as a reference for quality control throughout the day. Pictured here are two of the three screens you could possibly see on BCQM. The yellow screen indicates that QC is overdue. Once QC has been ran for the day, or shift depending on your facility, the yellow screen will turn white. The red screen indicates that something is wrong with the analyzer and that a service technician will be coming to your facility to work on the analyzer. Since the Sysmex communicates with BCQM, service technicians are alerted of issues without having to put in a service ticket over the phone. If your laptop is left open with BCQM running, these color-coded boxes make it easy to glance and see if your analyzer is working properly or if it needs attention. While the touchscreen monitor on top of the analyzer is your main control center, there are a few buttons on the analyzer itself that will be utilized all day long. The green button is the power button, and it simply needs pressed following shutdown to power the analyzer back up. The startup process takes approximately 15 minutes. The blue button is your start and stop button. When specimens are ran in sampler mode, this button needs pressed for sampling to begin. The gray button is for switching modes, and we will go over that in a few minutes. Here are the three levels of QC that need to be ran on the Sysmex XN550. Each tube is stable for 15 days refrigerated once opened. Each tube is also barcoded, so there is no need for programming the samples. To run QC, place your tubes in a tray, open one of the doors on the analyzer, place the tray inside and shut the door, then simply hit the start button. If one of your QC levels fails, the analyzer will alarm. If the analyzer does not alarm, you can assume that your QC passed, but it is good practice to review your results before running any patients. On the monitor, touch the QC file button to review your QC files. Each line will tell you the lot number, material used, the most recent analysis date and time, and the expiration date. From there, you can touch the button on the right side of the screen that has two squares in it. This will bring up your QC graphs. The light blue shaded areas on each of the graphs shows the acceptable limits for your QC. The dotted lines are the means, and any of the white areas are out of range. The turquoise line shows your last QC run. If your QC is out, there will be a red X on the graph to indicate what failed. Once your QC has passed, take a glance at the BCQM. Your screen should be white and say "Ready for samples." Now we will discuss the two modes of running samples, sampler mode and manual mode. Sampler mode can run 10 tubes per tray with a maximum of 2 trays at a time. You run patients just the same as how we discussed running QC. If you are running a specimen from a microtainer, you have to have the analyzer in manual mode. To do that, you simply push the gray mode switch button on the analyzer, then open the side door on the right. You have to program microtainer specimens, and to do that, you first touch manual on the monitor. This will bring up a screen that allows you to either type in your sample ID number or scan a barcode. The most important thing to do when running microtainers is to select the cap open button. Once you have your information entered, select OK. Take the cap off of your microtainer and place it in the black bracket holder. Once it is seated, push the blue start button located inside the door. This is the manual start button. If you were to push the sampler start button on the front of the analyzer, the machine would alarm. Every day of use, the Sysmex needs to be shut down. The process only takes about 2 minutes, but remember that startup takes about 15 minutes. So make sure shutdown is performed either at the end of the day or during a slow time. On the monitor main menu, simply hit the shutdown icon and then hit OK. While the Sysmex is usually a quiet and happy analyzer, occasionally it gets angry and will alarm and give you an alert. Most alerts will pop up onto the monitor immediately and give you a description of the problem. To silence the alarm, select Reset Alarm. To clear out an alert, select Accept, or to minimize the alert, select Close. If you need further information about the alert, select Instruction Manual. The alert shown here is telling us that routine cleaning is overdue. Routine cleaning is done weekly and should be done in place of shutdown. To perform routine cleaning, select Maintenance on the monitor, then select Rinse Instrument, and then Routine Cleaning. You will then take 1 tube of Cell Clean Auto and place it in the white tube holder on the manual mode side of the analyzer. Once you insert the tube, hit the blue Start button. The clean cycle will run and then the analyzer will shut itself down. Cell Clean is stored at room temperature and is to be disposed of after 1 use. This concludes the training video for the Sysmex XN550. Laboratory employees should now be able to perform daily maintenance and QC on the Sysmex XN550 analyzer under minimal supervision 100% of the time, and be able to accurately run patient samples on the Sysmex XN550 analyzer without supervision 100% of the time.